Nancy and Phyllis. When one listens, in the words of Carl Menninger, to people who are legion, whose lives were saved or fulfilled by the Recovery International system of Abraham Lowe, when one listens to these legions of people, as I have all my life, one first hears, "This program saved my life." I've heard it 1,000 times if I've heard it once. And then one hears a great reverence for the man, Abraham Lowe, although he's been dead for 56 years. Through his writings, they see him as a wise and tough and loving uncle. But the truth is, Abraham Lowe was a scientist. He had a pre-World War I German education and a medical degree from the University of Vienna. After emigrating to the United States in 1921, he became deeply involved in neurological studies here at the University of Illinois Medical School. Between 1929 and 1938, he published 6 major studies in brain research. 2 of these, from 1931 and 1933, were on agrammatism, or problems with reading grammatically, and acalculia, problems with doing simple mathematics. Those studies lay unnoticed for 50 years until they were rediscovered and hailed by neurologists in the 1980s as predicting brain theories a half-century in advance of current thinking. Abraham Lowe was always ahead of his time. Starting in 1937, as you've heard, he became interested in the mentally ill patients here at the UIC Psychiatric Institute. He saw the revolving door of release and readmittance, and wanted to do something about it. He took his scientific bent and applied it to the behavior and thought of the mentally ill. From 1937, when he began to call on patients here at the Psychiatric Institute to take charge of their own wellness process, until 1952, in that 15-year period, he forged his scientific knowledge of the brain, together with his Germanic Viennese empirical observation, into a systematic formulation of what would push people to take that final step to wellness, not maintenance, wellness. In those 15 years, he unquestionably, in my opinion, established the first system of cognitive behavioral therapy. It began here at UIC. The even greater genius of this accomplishment was that he boiled an entire system of intellectual theory and practices down into elements sufficiently simple for preoccupied mental patients to apply to themselves. And he cast these simple elements into a brilliant group structure and process that they could carry out on their own, true self-help, guided strictly by his structured group meeting format. All that is now called Abraham Lowe Self-Help Systems, but its flagship is called Recovery International. Let's examine that a bit. First, the Lowe system is not psychotherapy. We are lay people. We never ask about diagnosis, we don't talk about medication, and we don't tell people what to do about their life problems. We are a training system in how you manage your thoughts and how you manage your behavior. Recovery group leaders are ordinary, formerly sick people, and they often, sometimes get sick again. They have their ups and downs. But they've been in the training for a long time, and they train currently sick people in the continuing management of everyday disturbing episodes in their lives. We only deal with very specific everyday events. And we bring to those day-to-day events hundreds of simple tools formulated by Abraham Lowe, in which all participants train themselves to reduce agitation, anger, anxiety, and all the terrible symptoms of unbalanced thought. The basic principle of the Lowe self-help system is that inner calm is the greatest friend of the nervous system, and what he called temper is the greatest enemy of mental health. Temper is both anger and fear, because both anger and fear stem from the same cause, the judgment of wrong, against the outside world in anger, against ourselves in fear. Thus, overcoming both anger and fear, that judgment of wrong, is one of the great challenges in regaining and maintaining mental health. That requires changes in thought and changes in behavior, and both thoughts and behavior are subject to control by what he called the will. As it says on the bronze plaque in the lobby downstairs, the will says yes or no to thoughts and impulses. Impulses meaning behavior, the things we do with our muscles, including the speech muscles, which are the most difficult to control. Well, good enough, but how do we make that happen? We get people to sit in a group and speak the words of Abraham Lowe to each other as friendly commands. The most comforting is, symptoms are distressing but not dangerous. You can't imagine how many people say, that was the first thing I heard, and I kept repeating it all the time until the next meeting. It somehow is the life preserver that they can grab onto. If you can't change a situation, you have to change your attitude toward it. Drop the judgment against others and yourself. There are no uncontrollable impulses. There are only impulses we choose not to control. Feelings are not facts. Feelings lie and deceive. We get colorful every once in a while. Don't put a ceiling on the amount of discomfort you are willing to bear. Because if you're going to overcome the agonies of fury at every imagined slight, or the agonies of anxiety and panic that descend on you, you must bear discomfort. But bear discomfort and comfort will come. That's another tool, another very comforting tool. And of course, it is most comforting for people who are suffering these agonies to hear this tough talk, spoken always sympathetically, from people who have themselves experienced and overcome the terrible symptoms of mental illness. It's about building habits, and those habits are established through the brilliantly and deceptively simple meeting structure that Abraham Lowe created. Every meeting, led by a trained person who has come through the system, inculcates habits of thought that quickly or slowly invade the thinking and behavioral processes of the individual at whatever pace that person is able to absorb. The system is patient and forgiving. The meeting structure of Recovery International and all its variant programs takes each person through a series of 4, again, deceptively simple narrative steps that train us in objective observation of ourselves and our experiences, reinforce our coping tools, and make us recognize and praise our improvement. I've left out so much. The need to expect the setback and how to manage it, the relationship between symptoms, the organs, the muscles, and the brain, the essential role of language in mental health, the patient's sabotage of his or her own improvement, the construction of realistic philosophy of life, and the crucial role of hope, and so much more. Folks, all my life, I have watched this system make very sick people well. Certainly in cooperation with professional therapists, who, by the way, when they use us, say we make their patients better, more cooperative patients, because with us they learn to stop sabotaging the process. All my life, also, sadly, I have watched almost the entire psychotherapeutic world, with wonderful exceptions, ignore a low-cost system that sees itself as an adjunct to, not a substitute for, professional psychotherapy. We take people that last crucial mile of getting well, that only they can walk. Abraham Lowe's self-help system began here at the University of Illinois at Chicago. We are proud of that connection and hope that you will mirror that pride back to us. Cognitive behavioral therapy began here. Please learn about this very successful 70-plus-year-old program in its full depth and take credit as its birthplace. Thank you.